Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. Today we have another guest who has been part of the dental community for quite some time, who works as a hygienist. Go ahead and say hello, Lauren.
Hello. Thank you so much, Patrick, for having me on the Dental Brief.
Yeah, we're excited to have you here. We're excited to talk about today's subject. So, Lauren, you work as a hygienist. And tell me about who you work for and how you got into dentistry.
Yes. So I have actually worked for my dad since I was 15 years old. He kind of pulled me in one summer and didn't quite give me a choice, but trained me in about a week to be his assistant. And I never really left. So I love working with my dad. I love being his hygienist. He's always big on always improving in your career. So I've gotten to work with many great consultants throughout the years. He's a dentist that very much doesn't want to have to do hygiene. So he was able to give that over to me, which I've absolutely loved. And I just recently started a business with my sister. And we started, coaching, helping different offices. And I realized I absolutely love it. So yeah, that's what we're doing now.
At bonddentalconsulting.com. Let's talk a little bit about why you're in the episode today. This is, I think, interesting. This is going to be an interesting subject and something that's very important for our listeners today. So you're here to talk about the intraoral camera.
Yes, I am.
Yeah, so this is an amazing piece of equipment, right? A lot of practices invest a great deal of money in this piece of equipment. And then they use them all the time, and they use them so much they wear out.
Well, yeah, that would be the goal.
Right. But that's not what
not
really
always
happens.
the case.
That's not what really happens. Yeah. So people buy these, and they collect dust often. Yeah, right?
Oftentimes, yes.
Yeah,
they
so
do.
Tell me about this problem, and why does this problem exist?
I think this problem mainly exists from a lack of competence, which is something I totally get being a hygienist. I had the opportunity to have my dad pull me in on weekends to say, hey, you're going to be my eyes. So this is what to look for. This is how to tell the patient. But I don't think everybody has that opportunity. So I think in not knowing exactly what to look for or in the fear of messing up, I think that holds a lot of hygienists back from using something that I truly believe is the most successful tool they'll have in their office.
Sure. So, and by successful, when they use it, right?
Yes. Yeah.
So what are some of the fears that you have? What are some of the logistical issues that practices have in using? What are some actual real issues a hygienist may have in using the tool?
One of the real issues I found is they're an investment for sure. So I think it's hard for offices to be able to have them in each operatory. And realistically, if you're on a time crunch, hygienists are known for not wanting to be late. So having to get up, different things like that. So I truly do believe it has to be in each operatory. I've done a lot of research on trying to find an intraoral camera that is great, but is also affordable. I believe I did find that with a company called Mouthwatch, which I really have loved. I've loved talking with them and working with them. But I don't think, and I agree with them, they really believe that you don't have to overpay for essential tools just because you're a dentist. So I think that right there is one of the issues, not having it in each operatory. Time management is also, I think, a real struggle. So that's something that in having a plan of action to be able to put that into each appointment. I typically like to gather all of my information within 10 minutes of being with a patient. And that means I've taken a picture of anything that needs to be shown to the patient, even if it's a good picture. That creates that value in that appointment that helps with cancellations. It's so important, I think, to put value into each appointment. and then I go ahead and let my doctor know, hey, doctor, I've collected all of my data. He'll come in whenever he's available. I think that having that ability to go over that with the patient before the doctor comes in is crucial. Because I think most people come in and they're terrified.
Sure.
They're wanting to get out. So, you hear it once, you hear it twice. Never mind just hearing it, you're also seeing it. I think that's really important for case acceptance. So that is also a big thing. I think that if you are running behind, you're most likely not going to talk to the patient about one of the most important things you can talk to them about before they leave the office, because you don't want your patients in pain.
Right. So you're actually saying typically how it's used and how I've seen it used is an intraoral camera will be used to show a patient a problematic area, something that needs treatment, and it's used as a way to for case acceptance to sell treatment. What you're saying is, or one of the things that you're saying is, when you have a mouth that's in tip-top shape, there's no issues whatsoever. That's an actual time to use it as well. Absolutely. To show people how great everything looks, which I would assume in the future when there is an issue and they've come in for 6 cleanings in a row and they've gotten this clean bill of health and everything looks sparkly, and then you show them an issue, they're going to believe you, aren't they?
Absolutely.
They're going to look at it and go, oh yeah, that's very different than what I saw before.
Oh, absolutely. And I think it's also good to use it for encouragement. If a patient really turned their home care around, you took a picture of infection. That's my favorite, of course, because I'm a hygienist, that, bleeding, different things like that. And then they really did their part at home. You got to celebrate with them. So you have to take that picture. Have them be a part of their health. I think goes beyond just having people come in for cleanings, because that's not what we do. We try to help them get healthy.
Sure.
So I absolutely love if a doctor just did a beautiful crown on a tooth and they're not in pain, and I like to take a picture of that and say, look at how amazing this looks. Build that value. I mean, it goes into so many different things. I could talk forever about this, but referrals, that's kind of how it just is going to make that appointment so much different than if you're just talking to them and telling them what they need to do.
So right now, the average practice, most practices, I wouldn't say the average practice, so most practices are not using the camera on every patient, even if they have plenty of them sitting around, they're collecting dust. We like to give our listeners actions that they can take today. Like, what is something that they can do today? What are a couple of things that they could do today, 2 or 3 things that could change that, to inspire, to put together a process? What are those types of things that you recommend a practice doing tomorrow morning when they wake up to start using it 100% of the time?
One thing I did do, because I knew how big of an issue this was, is I created kind of a little mini course on how to get everybody on the same page, why it's important. And then a part of that is my implementation task. Starting tomorrow, come up with a goal. But no goal is going to be reached without accountability. So a part of that is use your meetings, use your morning huddle. I like to use our morning huddle where it's, hey, I took an intraoral photo on every single patient. Or if I didn't, I'm going to know why. And I think in the beginning, when you start anything new, you have to have that. Because again, I think that everybody can go in wanting to do this, but if nobody's tracking it, it doesn't go anywhere. So I think that is something that starting even tomorrow, come up with your plan. Come up with, okay, guys, let's get on the same page. Let's figure out, starting today, let's take it on 3. We don't have to go crazy and take it on everybody, but let's communicate with each other to see how are we doing. Celebrate when you're doing it. Talk about what you can change up when you troubleshoot. I do believe you can't be very, very negative about it. That's going to kind of crush your team. I think you have to be realistic. You have to be encouraging, but you still can meet goals. And so that's one thing I would really suggest every office kind of do, is come up with that plan.
Yeah. So when you talk to practices, what percentage you ask around, what percentages of practices do you think are using it, or 50% of the time or less?
Oh, 50% of the time. I have run across so far 2 offices that try to take a picture on every single patient.
Got it. So,
but that's it.
So it's probably outside of chairs in waiting rooms right now is probably the least used thing inside of a dental practice. And I say that here in the wake of COVID, right, where waiting rooms
Right.
are no longer
Right.
needed.
Absolutely.
Yeah. So your course, it's on bonddentalconsulting.com/mini course, correct?
Yes.
Okay.
Yes.
And so I want to encourage our audience to go there and check that out. There's a lot of great information there that I think they'll find useful. Let me go ahead and, Lauren, leave the next couple of minutes up to you to share with our audience. What else would you like to add to this great amount of value you've brought us today?
I think value is the word. I know I've been a little bit different working for a family practice, I'm sure. My patients, I know them each by name. And that's what I love about what I do. I always say I love teeth. I love helping get people healthy, but I love people. And I think in today's world where everybody's spending more on getting your hair done than they are on necessary treatment to keep your body healthy, I think it comes in building the value in what you offer. A lot of that comes by what we say, what we don't say, but then spending the time making that connection with people and meeting them where they are and being able to adapt yourself to successfully, have them schedule their treatment.
Sure. Do you think with regards to revenue and case acceptance, when you see high usages of the intraoral camera, do you see revenue and case acceptance jump quite a bit too?
Absolutely. And I think, I know when we first started it, I think it went up at least 25%.
Wow.
I'm big on numbers. I love my numbers. I'm just in competition with myself. So I like my case acceptance to be at 80% or higher. And so it took us a little while to be able to get there and find out exactly what words we need to change and different things like that. And if somebody is struggling a little bit in case acceptance, being able to talk about it.
Sure.
And being a team, I think that's so difficult sometimes. And in all reality, you guys all want the same goal.
Yeah.
So
yeah, and I think too, I've been seeing this a lot, and it clicked on me. I always hear dentists talk about how upsetting it is that everyone quote hates the dentist. Right. I think once people understand how valuable oral health is to their overall health, they no longer hate the dentist. They actually enjoy going. They like going. It becomes like the gym. Sure, it's not the most comfortable experience in the world,
right?
But neither's the gym, right? But we still do it. So I want to thank you very much, Lauren. It's a pleasure having you here. I'm glad that you're in the consulting role and helping dentists. I think this is an area that so many need help with, hygienists as well. So thank you so much for coming on.
Thank you so much, Patrick. I enjoyed it.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.